Welcome. My name is Amanda Marcinowska. I'm a graduate student from McGill University and the principal investigator of this research study. This research study is conducted in partnership with the Santa Marcelina Network. Our project aims to identify the primary healthcare research priorities in the underserved regions of Sao Paulo, Brazil. We will be using a multi-paneled participatory Delphi approach, which will involve healthcare professionals and administrators of the Santa Marcelina Primary Healthcare Network. This study will take place in eastern Sao Paulo, which is located in the southeast region of Brazil. We will involve these 5 districts in our study. The eastern region of Sao Paulo has a poor health profile relative to Sao Paulo municipality, and it's characterized by huge social and economic inequalities. The 5 districts in which our research is conducted are among the poorest and most marginalized in the city, with high unemployment rates and lack of public transportation. There are insufficient public policies in place within these regions to address these problems. In addition to the burden of diseases, mental health issues, early pregnancy, and high rates of homicide and road traffic injuries, there is also stigma of social violence contributing to the burden these regions face. Eastern Sao Paulo is characterized by much poorer health indicators and socioeconomic indices, greater inequities, and a higher poverty index than the Sao Paulo city average. The Santa Marcelina Primary Healthcare Network has been operating in the eastern region of Sao Paulo since 1996, currently in partnership with the Municipal Health Secretariat of Sao Paulo, providing services to over 1 million people in these 5 districts. Santa Marcelina manages 128 different primary healthcare services. In addition, this network also focuses on teaching and research. The purpose of this study is to inquire on perceived research needs among health professionals and administrators of the Santa Marcelina Primary Healthcare Network in order to establish the top research priorities for the underserved regions of eastern Sao Paulo, Brazil. This study adopts a participatory approach where we engage local stakeholders in key stages of the research process. Active involvement of local health professionals, medical directors, and administrators can enable the findings to have a greater impact and increase the possibility of reaching Brazilian health officials, funders, and policymakers. To facilitate this collaborative process, we hold face-to-face discussions, video conference calls, and email exchanges. These communications allow us to build trust with the stakeholders, inform them of the pertinence of the research, and support their commitment to the study, while increasing the relevance of our research to the local context. We actively sought input from the local stakeholders throughout the study, from the initial research idea, and will involve them throughout the study up until the dissemination and integration of findings. The conception of the research idea arose from discussions between McGill University researchers and stakeholders of the Santa Marcelina Network. The need to establish relevant research topics for the local context was identified, and an approach was proposed to address this need. We have involved stakeholders in the planning of the research study, including discussions on feasibility, instrument development, selecting relevant stakeholder groups as participants, and the logistics of carrying out this study, which allowed us to create a relevant research proposal. We gained knowledge about the local needs through regular information exchanges with stakeholders and data collection. Discussions on the process of finding implementation will continue throughout the study. The research findings will be shared with study participants and other stakeholders through peer-reviewed publications, conferences, workshops, webinars, and other forums which include the presence of governmental and non-governmental bodies, funders, and policymakers. The results will also be published in the form of a thesis. This participatory approach allows for the exchange of knowledge and expertise, which builds research capacity for conducting future research studies in the underserved areas of Sao Paulo, and develops sustainable relationships between McGill University and our Brazilian partners. Our ongoing involvement with the stakeholders can be shown with these 6 stages. In the first stage of study design and instrument development, we engage stakeholders in discussions regarding study design and the development of the instruments that will be used in the study. and this will allow us to better meet their needs and help shape the output of the study in order to be the most useful for the local context. In Stage 2, the participant recruitment involved communications from board and team leaders and management of Santa Marcelina, who provided us with the information about the organizational structure of Santa Marcelina and the role of each primary healthcare unit within their organization. This information helped us compose a list of potential participants who are experts in the specific area of primary healthcare. This enabled us to come up with a purposeful sample of participants who were asked to suggest other experts within their organization that could contribute to the study based on their experiential knowledge. In the third stage, the coordinators of Santa Marcelina participated in the preparation and conduction of the pilot test to ensure that the survey questions and instructions are easy to understand for the Delphi respondents, the online tool is easy to navigate, and the anticipated output can be achieved. Before commencing the survey rounds, the participants will be given a presentation on the overall study aims and the research question training session in order to refresh their skills in formulating research questions, including using the PICO format. In Stage 5, 3 rounds of the Delphi surveys will be conducted, where participants will independently work on their questionnaires, and the researchers will provide feedback between each round. The final stage is the dissemination of findings. The participants will be invited to attend a presentation of the findings and have the opportunity to voice their opinions on the results. Research priority setting is an effective strategy to identify existing research gaps and establish a relevant research agenda, which can help direct future research. Priority setting conducted at the local level can help reach marginalized and vulnerable populations and address the needs of local communities. Setting priorities in health research is especially important within the constraints of available resources and variation in the prevalence of diseases or other health issues between regions. The Delphi method is the most common approach used to identify priorities in primary healthcare. It's a group facilitation technique that gathers the opinions of experts who possess similar levels of expertise in a specific topic. Participants in the Delphi study form a group of informed individuals who are knowledgeable about a topic of inquiry, and they are referred to as a Delphi panel. Our study will involve 3 sequential rounds and will also include face-to-face panel discussions for each round in order to address any questions the participants may have and provide them with the necessary training and instructions for the survey round. We will provide participants with 3 rounds of the surveys. In the first survey round, participants will independently identify issues in need of research and formulate research questions based on the identified research needs. In the second survey round, they will independently rate the importance of each research question previously identified by the panel. In the third survey round, they will independently arrange the top 10 research questions that have been identified from the previous round in order of priority. The Delphi panel's prior responses will be fed back in a summarized form at each step of the iterative Delphi process. This will allow the participants' informed judgment to be developed and refined. Qualitative analysis will be carried out for Round 1 data. Specifically, we will use inductive thematic analysis to collate the research questions which have been generated by each panel into themes. Statistical analysis will be done for responses from rounds 2 and 3. The data obtained from these rounds will be analyzed using descriptive statistics in the form of mean scores to show the level of importance and standard deviation to indicate the level of dispersion for each research question. The questionnaire for the first Delphi round will allow for free text responses. The participants will be asked to list 5 research questions within the primary healthcare domain they have expertise within. They will also be given the option to provide reasoning for each of the research questions they suggested. The questionnaire for the second round will involve all the research questions suggested by the panel from the first round. The research questions will be grouped by theme, and participants will be asked to rate the level of importance of each research question using a 5-point Likert scale using the provided legend. The number 1 will indicate that the research question is not important to be addressed through research, and the number 5 will indicate that the research question is absolutely necessary to be addressed through research. The questionnaire for the third round will involve the panel's 10 highest rated research questions from the second round. The participants will be asked to arrange these research questions in descending order of priority so that the top of the list has the highest priority research questions. This study will implement a multi-panel approach by dividing participants into 8 different primary healthcare domains based on their expertise. The 8 distinct panels of Delphi respondents will work in parallel so that each panel will create research priorities for a different domain of primary healthcare. In this way, several Delphi processes will occur simultaneously. The participants will work independently on the different primary healthcare domains, including child and maternal health, communicable diseases, non-communicable diseases, mental health, urgent and emergency care, patient safety, care coordination, or health services management. This categorization is partially motivated by the organizational structure of primary healthcare services within Santa Marcelina. Input from various perspectives of the primary healthcare teams is crucial, given the variability of issues in the broad field of primary healthcare. Therefore, each panel will be comprised of a diverse group of stakeholders which possess expertise in a specific domain of primary healthcare. In this study, we define expertise as relevant knowledge and experiences in the specific domain of primary healthcare. We will purposefully invite Santa Marcelina's primary healthcare medical directors, healthcare professionals, coordinators, and managerial staff from the 5 districts of Eastern Sao Paulo to participate in this study, and we will also ask them to refer other potential study participants. Our recruitment target will be about 100 to 140 experts, accounting for an average of 15 to 18 participants in each of the 8 panels. The following chart presents the flow of the study with all the pertinent steps of the research. We began the research process by defining the scope of the study and identified stakeholders to collaborate with in order to proceed with the next steps of the research. We engaged stakeholders in the study design, participant recruitment, and pilot test. This set the foundation for the initiation of the Delphi rounds, starting with the first round of eliciting research questions. The round 1 data will be analyzed and used to construct the round 2 questionnaire. The second round involves rating of research questions, and the data is analyzed and used to construct the third round questionnaire. The third round involves ranking of the research questions, which will provide the data needed to establish the 10 top research questions in priority rank order. The results will be presented as a final report and distributed to various stakeholder groups. Additional knowledge translation and dissemination activities will also take place. The findings from this study will present 8 prioritized lists of top research questions from the 8 primary healthcare domains, arranged in descending order of importance from the highest to lowest priority. The primary healthcare research needs identified by key stakeholders will help inform future research in Eastern Sao Paulo and direct resources to the most essential needs. It is expected that the research priorities identified through the study will be addressed in future research studies, and therefore will have a positive impact on the health promotion and prevention of diseases, delivery of high-quality services, better health coordination, and efficient management of primary healthcare. The results obtained through our study can serve as a primary avenue to relevant, high-quality future research aligned with the local needs, which ultimately can lead to improvements within these communities by promoting evidence-based practice, improving the quality of healthcare services and organization of primary healthcare, and also improve the quality of education for staff and the public. It is likely that relevant local research will help improve policies relating to health and community-based primary healthcare, leading to reductions in health disparities existing in this region. We would like to thank all our research partners from Santa Marcelina Primary Healthcare and our research team from McGill University. Thank you for listening, and we would also like to thank all our study participants of Santa Marcelina Primary Healthcare.